about a year ago, I was in a wheelchair. By week 7, my body had rebounded to a point where I could get up and move around. I was out of the wheelchair. I was starting to regain the strength in my extremities and being able to support my weight on myself. And I still need bilateral support. I don't want anybody to think that this is just some sort of miracle that fell out of the sky. It was a process, but I was able to move around again.
AI isn't going to replace doctors. It's doctors using AI that will end up phasing out and replacing those doctors.
Yeah, so I'll dive in, right? So Nexus Health was built to help people be healthy, right? That's the overall vision and goal of the company. And we don't feel like health should be something that's astronomically expensive or way out there. We feel like it's something that should be attainable for every person. The way we go about that is we empower functional health practitioners with information that they wouldn't have otherwise. So we do a deep analysis on people to be able to understand them at their foundational levels, and then give functional practitioners the capability to articulate back to their patients what the proper protocols are going to be, how they can repair their bodies naturally, and how they can optimize their health. So that's what we've built, and that's what we're taking to market.
Oh, awesome. Okay. And how long have you guys been working on this?
Working on this now for about 2.5 years, and to kind of spin off on what Steven said, one of the core concepts of the company, and especially the engine and the algorithm, is it's a very unbiased view onto your health. It's an unbiased, uncatered look into the reality of your genetics and your biology. I noticed, as I was going through some kind of health issues with myself, with my parents, with some family members, that every direction seemed to kind of be jaded. It always had a biased, opinion or whatnot on what they should take, when they should take it, how they should take it, what brand and whatnot. So when I started developing this, about 2.5 years ago, I really went at the angle of there's no outside influence, there's no bias, and there's no, external opinion. It's just true root cause analysis of what's happening on inside of the human body.
Yeah, it's a great call, John. Just to kind of add to that, like, health it's a challenge in general, and it's hard, especially in America, because our healthcare system is so fractured and broken, to really get real answers that are unbiased. And that's one of the unique things that we bring to the market, is that unbiased view into someone's health, and instead of being, let's just say it this way, bought by a pharmaceutical company. We're really just trying to look at people holistically and understand what's going to be best for them, not what just came out of a pharmaceutical rep's handbag.
Yeah. All of our training, all of our data, and the way we produce all of our protocols doesn't have any type of outside influence on direction, or maybe an end result of a brand recommendation around a supplement stack, right? There's zero outside influence from a financial gain aspect. It's truly unbiased. And I haven't really seen anything like that in the market. So, coming from some of my previous roles, I felt like if we weren't going to build it, nobody else would. Other systems like this are being developed and designed to give a truly uncatered look, but they're going to be behind closed doors. And something like this, where you're looking at genetics along with biology, is being developed, but it's not going to be released. It's going to be a tool that's going to be for the elite. It's going to be a tool that's going to be available behind closed doors at large hospitals and large institutes. But for the general practitioner, for the general wellness, health and wellness clinic, it'll be out of reach. And so I felt with the way technology, the way AI technology has been advancing, if somebody doesn't kind of come along and say, hey, we can commoditize this level of analysis and bring it down into the standard health and wellness clinic, who else would, right? Nobody else will. And that's kind of why we're the only one on the market doing it. That's why we don't see a lot of competitors going after clinics. It's different. You go after end users and consumers. You offer a different level of service. You're not integrating genetics. There's not a lot of complexity behind it. Since we're integrating the genetics and we're still keeping the human in the loop, one of the core concepts of Nexus Health is AI isn't going to replace doctors. It's doctors using AI that will end up phasing out and replacing those doctors. And so we're building the tools that provides technology that's leaps and bounds ahead of what consumer grade technology is. So as patients start approaching their doctors with, rather than a Google search or a WebMD search, they're now having full-blown AI conversations about their symptoms. They're uploading their own labs. talking to GPTs and Geminis about their health and wellness, they're not getting a true unbiased look, and they're not getting all of the information because it's not a real analytical system. It's just a commercial-based AI that's looking at kind of a broad aspect of that report. So we're building a platform that enables clinicians to utilize this AI technology inside of their practice without disrupting their day-to-day clinical workflow.
So how did you guys stumble across this? Like, what problem did you guys see that gave you this great idea to go after this?
Go ahead, John.
You know, as I was kind of realizing through some of the testing that was being done on both myself and some family members, that when you go to a clinic or a practitioner, they are an expert or a master at one domain. You know, it takes years to become an expert in a specific domain, but the data that they're presented with is such a widespread amount of exact results, but the interpretation is lacked because each clinician is only an expert in one realm. So traditionally, if you wanted to really look at an end-to-end soup to nuts overview of the body, look at predispositions, look at the actual bioexpressions, you went to 4 or 5 different specialists. You went to cardiologists, you went to a different type of neurologists that are looking at different subsystems to see how they interact to compile a full report. Then you take that back to your general practitioner, your general MD, and they're the ones that have to put all that together. There's a disseparation between each one of those domains, each one of those clinics, and the amount of time that it takes to generate that type of topographical report was months. And so kind of going through that with my own, kind of problems and whatnot, and some of my family members, finding that, with AI and some of the robust training that can be done, I started off with a small model. What can we do, and how can it become a genetic expert and weigh in on some of the key aspects of the biology? Why can't we train and tune that to be more of an analytical engine? It doesn't have to be a diagnostic engine. We're not looking for cancer. We're not looking for things that's actually going to diagnose. It's really looking at how the system works end to end. And so seeing that there's nothing really on the market that allows a clinician or a doctor to be an expert in all domains. I, as an engineer, working for a large aerospace company, became an expert in multiple domains by utilizing AI to teach me and reverse engineer topics to me. I was able to learn incredibly fast. So I kind of took that same methodology and applied it to, why can't we put that in the medical space? Make and allow a general practitioner or clinician become an expert in multiple domains. That way, when they are looking at genetics, when they are looking at the biology and maybe a space that isn't naturally comfortable to them, they have the reassurance through our justification and our reasoning and our reporting that, yes, the AI did produce it correctly, but now I do have the justification. Now I do have the actual clinical output from this domain that I might not have been an expert in. So it was really trying to solve a problem that I didn't see anybody else going after. And I could see an inherent problem where you could see a massive growth in knowledge in one space that wasn't being applied in another.
And I think to John's point there's like, to make it even more personal, one of the things that was really impactful when John started bringing these ideas to me of building something like this and making it something that could actually really help people, it is my own experience, right? So, I have an autoimmune disease, and it's a rare autoimmune disease. So it took 10 years to figure out what was going on in my body. And along those 10 years, I was always being treated for my symptoms. I wasn't being treated as a holistic system, right? So my biology was being manipulated based on how I was feeling rather than what was really going on behind the scenes. And what's really unique about what we can do and what we've done and why it's so important is because it's able to look at that holistic view of a body and really understand how things are being expressed as a full system rather than just those different symptoms that different practitioners typically have to manage in their own domains, right? So kind of what John was talking about with the different domain knowledge, I mean, you can't be an expert in everything. So it's no fault of the practitioners themselves that not being able to be an expert in everything. They have their specialties. Where the problem and where it breaks down is that analysis of all the data that they're gathering, being able to help fill in the gaps and the voids that they may not be expertise in, and then giving them the confidence level that there is some really good clinical reasoning behind this, so they feel like they're actually practicing their medicine correctly rather than just kind of guesswork or avoiding something that they're uncomfortable with or don't know anything about.
Interesting. what kind of data are you guys looking at to like see a person as like a whole? Like, can you help me understand that?
Yeah, yeah. I'll start, and then John, you can dive in, right? So,
Perfect.
first off is the building blocks of life, right? What is that? It's your DNA, right? So the DNA is really critical to us. It expresses who you are, right? What makes you uniquely you? That's your DNA. So that's one piece of data that we really want to gather, and it sounds minimal just by saying DNA, but it is a big deal. It's really important. The other thing that we grab is lab work, right? And we have a minimal viable blood work panel that we look for, and it's quite a bit of blood. We're not a finger prick, right? We're
Yeah.
not those guys. We're taking real vials of blood.
Mhm.
Make sure you're ready to eat lunch afterwards when you take our blood, because it is a good bit. And we're looking at all the different bioexpressions that are going to match to that DNA. But what's really unique about what we've done, and this is where I'm going to ask John to chime in more, is that's the starting point, but we actually can go really deep in the data. The more data we have, the more accurate and precise we can be in the outcomes that we're trying to deliver. So John, if you could talk more
Yeah.
about what we can take.
Yeah. So starting from the base, we ingest DNA and the labs. Zero interpretation. There's no clinical interpretation from a doctor. What we start off is with the base genetic analysis. We take in the full S&P stack of your raw DNA, and we compare it against a proprietary database that's looking for genetic predispositions. Once we've isolated those predispositions, we go through and we look at the genome type, its position, and we apply a score and a weight to it. We take that data, we apply that to basically a disposition list, and then from those labs that we've drawn, we look for which dispositions and which predispositions are being expressed within that biology and how much they're being expressed. So based off of the level of the result from the biology, we also put a weight and a score to those metrics as well. One of the key things that differentiates us from maybe a competitor or even a lab in a hospital is we weight from 1 to 100. We score from 1 to 100. Generally, the industry standard is 1 to 16 or even 1 to 36. The fact that we're doing it from 1 to 100, I've been told by several geneticists, is kind of wild that, that essentially we're almost doing cancer screening level assembly on the genetics and comparing it to the biology and the expressions and then doing the weight comparison. And that's how we derive kind of the waterfall effect of what's next. Well, now we're actually showing you an insight of that human in that state and point. From that, we can generate the supplement protocol, what that body's missing because of the genetics and because we can see the weights of the predispositions. So you're susceptible to X, Y, and Z. You're expressing X, Y, and Z at a specific level. We have kind of a patent pending algorithm that looks at that and weights it and says, well, now you have what's called BaselineONE. What would you look like as a not perfect, but as just a generalized 98.9% BaselineONE of that human? That gives us our base score, and from that we do a subtraction algorithm that then generates the supplements that you would need. From there, we then can see when you need to take it, how often you need to take, what you need to take it with, based off of your other dispositions, allergies, and adversities. So it's a very minute, granular way to look at health and wellness because we're screening it basically as deep as a cancer research diagnostic facility would. But we are not a diagnostic engine.
Okay. So the way I understand this then is, so it takes these systems and then it scores them and then gives the doctor like a whole, what would you call it? Like system notes on everything, and then it creates a protocol with it. Is it just supplements or is it like more than that?
Oh, great question. So, and John kind of started to allude to it a little bit as well, is that, when we generate the protocol, even with the supplements, ties to when and how you should take those things, right? So what's nice about what we provide in our reporting to our practitioners is it's like in high school when you went to math class. I mean, I was I loved physics, but I was the guy that could come up with the answer in my head and write it down. I didn't show my work, right? So, but my physics teacher would tell me, hey, you didn't show the work, you only get partial credit. What we do is we're giving the full details of how we came up with what we came up with. And that's through our entire report for every section of our report. When it comes to the protocol generation, we're not just looking at strictly supplements that are going to help. That subtraction algorithm that John was talking about, what's still missing, what do we need to put in there? We also look at the nutrient side. What type of foods are going to optimize this body? What type of food should they completely ignore? Like stay away from these things. And what are the foods that are okay in moderation? We're not a diet plan. We're not going to tell you go on keto. We're not going to tell you do the South Beach diet, right? We're going to tell you, hey, these are good for you based on your bio expressions and based on your genes, and these are bad for you based on the same information. And then the other thing that's really, really critical that I think a lot of times gets missed in this type of analysis is the circadian rhythm. What does your body's natural timeline look like day in, day out? And we can provide lifestyle changes that will help your body metabolize things and use the stuff that you're putting in it more optimally based on the rhythm of life that your body goes through. So, for example, we have a patient that their circadian rhythm has been struggling for a long time. They have some hormone issues aligned and all these things. One of the simple things that was put into their protocol was just go outside and get some sunlight for about 15 minutes before 10 a.m. That resets your body. It kickstarts your natural processes inside of your body to align to the circadian rhythm that your body needs. If you don't get that sunlight, your body doesn't necessarily metabolize correctly the supplements you're putting in, the nutrients you're putting in, and it can throw off the sleep cycle, completely throw off that sleep cycle. It's something simple like that that's a lifestyle change that comes along with our protocol too. So it's not just supplements, it's supplements plus nutritional plus lifestyle that's really going to drive this thing forward.
And to kind of double click on that a little bit. So that's a really good example, right? Going out and just standing in the sun. That's not going to be in every report. That's not for everybody. We base that off of your genetics. Every report is genetically created, meaning that we do not have templates. Every report will look unique. Every single recommendation is unique, and it's based truly off of that individual. It's not t-shirt size. So one person might have that recommendation, might sound silly, but it's a powerful small change that will work for some people and doesn't for the others. And that's why we don't just blanket recommend, is because once we see something that is notable and report worthy, like, hey, go out and stand in the sun for the 10 minutes in the morning because we've noticed that you have R3-137, genome type 33 in position 147. By the way, based off of all of the global research, we've identified that gene to say that you need vitamin D in the morning to be able to start your day, to start your body and get it going. Some people don't need vitamin D in the morning. Some people need electrolytes. Some people need carbohydrates. Some people don't. They say caffeine, but some people need specific types of nutrients in the morning. That's why some people wake up starving. Some people wake up not starving and they're just thirsty. Their body's starved for electrolytes and carbohydrates and replenishing the fluid in their body, rather than some people waking up requiring, hey, I just need something as simple as vitamin D to get me going. You'd be really surprised at those little tiny changes, how much better you'll feel and how much more your body will be optimized. That's really what the report's about, is full optimization, not fixing one and ignoring another.
So it truly is personalized then for each specific person.
100%.
100%. Yeah. Each page is internally and genetically created. So one of the things I think that's a good thing to call out there, not necessarily with our competition, but other AI generated analysis recommendation engines, however you want to term it. We've found, in our market research, that they're all templatized. They're pulling from a database of maybe 5,000 pages. If you match this genome with this expression in your biology, boom, they put that page in your report. You line all that up. Now you have a 50 or 60 page report because you matched all these different criterias. But if you have 75 people all take those, same tests, get the same reports, you'll start finding that, oh, wow, 14 of the pages are the same and multiple of them because they all showed the same R231.7 expression with the genome type TT. They all fell under the same category, so they all got the same pages in the report. If we had 70 people and 15 of them all had that same genomic expression, every single one of ours would be different because everybody's expressing it at a different biological rate. Just because you're prone to it, just because you have the genetic disposition, doesn't mean that you're actually expressing it and at a level of expression that's worth reporting. So that's why each one is going to be completely different. It's 100% personalized to the individual. No other company's doing that right now.
Wow. Okay. So that was going to be my next question, is how you guys are differentiated from your competitors right now, and what makes you guys unique. So it sounds like that is what makes you guys unique.
Yeah, definitely. It's the personalization, but we go a step beyond a lot of the competitors that we see in the industry. While we're giving that deep, detailed analysis, and there are other companies that do that deep, detailed analysis, maybe not quite at the precision level that we're at. One of the things that we take another step for is we actually provide a protocol stage and phased out for each individual, right? So we one of the challenges you have, especially in the functional medicine space, is like it's a little bit of a shotgun style, right? It's like, okay, we're going to try all these things and then we're going to see how you feel. And it's somewhat subjective based on how the patient reports back to the clinician. And in some cases, never reports back how they're feeling because they're like, I don't feel any different. So why should I go back to that doctor, right? What we're doing is we actually give them a true roadmap, a repair roadmap to try to fix the systems going in their body and give them that optimization in piecemeal. Rather than trying to throw everything at them at one time, we're saying, no, phase one, this is the most important thing that we need to try to fix. This is the most important thing that needs our attention. Okay, now in phase two, we're going to work on these things. And each of those phases has their own unique protocols that go along with them. Again, nutritional, lifestyle, and supplemental, right? That go in each phase to help the person actually repair along the way. And then we built in checkpoints for the practitioners to be able to say, okay, now's a good time for us to double check this specific biomarker and see, are we seeing the improvement that we should be seeing or that we were predicted to be seeing at this point in time? So we're being very proactive in the way that we're working towards those protocols rather than just saying, here's the analysis, good luck. Here's all the supplements we think you need. Good luck with them. We're saying we're being much more prescriptive and no, this is the way that you actually want to do this. And then, oh, by the way, it's not a subjective response from the patient to say, I feel better, I don't, although that's important. Patient interaction is important. I'm not eliminating that altogether, but I'm saying we also need the objective side to measure that against. Because sometimes, you'll take supplements, you'll do something, and you don't really feel much different. But when you do a blood expression, you look at the expression, you look at the biomarkers again, and you can see the actual movement of what's been happening inside the body. So while you may not feel it, it's actually happening. It's real. It gives them real science and real objectivity behind their patient care. They're not just getting that subjective feedback. So it's a little unique in what we do. We really try to give that true roadmap to success rather than just an analysis and throwing everything at the wall to see what sticks.
Okay. So does this like diagnose people, or is this like if I had Hashimoto's and I didn't know what it was, would this tell me that?
Go ahead, John.
So we are not, the Biomatrix engine is not a diagnostic engine. It's a analytical reporting engine. So it's really centered around putting a lot of pieces together and producing the result and an action plan around it. Can it be interpreted as diagnostic? Not really, but what it can do is it can really give you a heavy insight and influence on a diagnosis. So if there was something internally going on and whatnot that supplements aren't necessarily going to remediate, it'll bubble that to the surface, but in no way are we going to be replacing a clinician or an actual doctor going in and doing a diagnostic and prescriptive. There's a difference between a supplement recommendation and an actual diagnostic that says this is the mechanical problem, this is the functional requirement to fix it, and this should be the end result. That's diagnosis and treatment. The difference is, we are looking, observing, computing, and recommending.
Yeah, that's a great differentiation that you called out there, John. You know, let's be 100% clear for anybody listening to this. I am not a doctor, right? We are engineers that are able to really understand things in a very scientific level, but we are not doctors. Medical authority should stay with medical practitioners.
Yep.
So when it comes to diagnosing diseases, just like a practitioner would do today, they take the information that they have and they make the determination off of it. What we're doing is we're giving them that information in a much more clear and precise manner so they can make the proper decisions diagnostically for their patient rather than having to do all this hodgepodge pulling things together and then reading medical journals in the middle of the night. We're giving them the full clinical reasoning behind what's going on inside of their patient, but the diagnosis belongs to the practitioner. They went to school for this. They know what they're doing. Some of them have been practicing medicine for 20, 30 years. They've seen the movie over and over again. You want that in your healthcare journey. You want someone that's looking at this, understands the medicine to make the diagnostic call. You don't want AI making a diagnostic call for you. AI is really good at giving you information. It's not going to be the one that you want to trust a diagnosis to.
Yeah, so we give recommendations all the way down. Like take our supplement protocol generator, for example. We'll tell the patient, tell the clinician, we're recommending zinc. Take it by capsule, 15 milligrams per day. That's phase 3 of the protocol. It's up, is it safe? Yeah. Is it been recommended to that patient? Yes. But the clinician knows that patient better. And so the clinician can say, you know what, I know Betsy's going to have a little reaction to this. Instead of zinc, how about we swap it out for, a different type of supplement, or just lower the dosage or whatnot, or change it to every other day. It's really about the clinicians still having that end control, because the way the system's built, we are clinician first, meaning that all of the recommendations, the supplement protocol generator actually has to be human approved before it can be released to any of the patients. So we still keep the human in the loop to disagree with the AI recommendations, not just say, here is the diagnostic or here's the diagnosis for the end result.
Okay. Speaking of AI recommendations, there is a lot of hesitancy about AI in the healthcare space. So I'd just like your guys' opinion on how you guys are protecting that space, watching out for hallucinations and people's data and things of that nature.
Yeah, I'll grab that one real quick and then kind of spin it off to Steve. So, not to get too technical, but, we are HIPAA compliant, HIPAA certified. So that's as simple as, encrypting data, not storing PII. We, scrub all of the personal information and no social security numbers, addresses, medical record IDs, or anything like that's put through any of our systems. Everything's, pre-scrubbed before it goes in. So that's kind of one step. The second step is any of the data, all the reports and whatnot is all encrypted in flight and at rest. It's built as an aero grade, technology. So it's more than HIPAA compliant to say the least. As far as, patient identity and patient rights and kind of privacy, we are a patient privacy first company. We're not in the business of data mining, data acquisition, data sales, or anything like that. We make it incredibly easy for patients to delete their accounts. We're not like some of the other genetic processing companies where you have to send an email, put in a request, or it's buried, deep into the website. It's right in your profile, delete data, thank you very much, have a great day. And it's wiped out of our system, and we have, auditable tracking to show, the end consumer and external auditors that, yes, we do wipe the data right away. We don't wait 30 days, and there's no mining, there's no retention or anything like that. Nothing crazy. I'm a big believer in that, as I've had my data sucked out of my life, all my life. If I'm going to develop a product, I don't have to bake that into it, right? And then as far as data integrity, we do daily backups and our system is cloud-based and compliant and whatnot. But, at a higher level, it's really built to work not only with end users and hospital grade systems, but we're not replacing your traditional EHR, EMR type system, right? We're an integration point to that.
Yeah, and I'll add to what John said there. He went into a lot of the technical details of how we secure the data, and that's really critical, right? For a practitioner to trust us with their patient data, it's critical that we align to the standards that are out there. And I really feel like we as an organization went above and beyond to make sure privacy was first. I feel like that's critically important. Another question you asked was around the kind of, I'm going to call it the stigma of AI in healthcare, right? And a lot of that is because of, let's face it, we read an article every single day, this AI hallucinated something and just went completely off the rails. And in the healthcare space, you don't want that because that could actually hurt people. It could really cause them a lot of harm. So what we've done with our system is we've done a few things, right? First and foremost is you can't solve a problem if you don't identify that it's actually a problem, right? And the fact of the matter is AI does hallucinate. Let's not sweep that under the rug. Let's not hide it. Let's not run away from it. Let's just know it and own it as a challenge. AI can hallucinate, and it does hallucinate. So what did we do around that? A few different things. Some of it is in our architecture. We pulled as much out of an AI engine as we possibly could so that we could manage it in a way that it's not putting too much into the AI system and not putting too much trust into the AI system. The other piece that we've done is we triangulate results. There's a quorum built in our system that provides us a checks and balances of the AI. So is the AI giving the accurate response? And we asked that a few different times to make sure that the response coming back is quorum agreed. This is the accurate response. Now, that's a way that we try to eliminate it. Is it going to 100% eliminate hallucinations? No. It's AI. There's still a chance of hallucination there. This is why it's so critical, and John mentioned it before, that there is a clinician there, a human there, looking at all of this and saying, yes, I agree, this is right for my patient. Kind of back to what I was saying about medical authority staying with the practitioner. It's the same thing here, right? We don't want to just be AI. We want AI to be an augmentation to clinicians who have the know-how and know what to do for their patients.
Yeah, and Steve kind of Steve kind of mentioned it, but I'll double click on it a little bit. We do have a proprietary in-house trained LM, but we also do use some of the foundation models, but we use them for truly weighted analysis and for depth of knowledge. The triangulation and arbitration he was talking about was when we have, our internal Nexi model send out for analysis. It's looking at, 3 of the foundation models. It gets a response back. Our internal Nexi model will then arbitrate that and say, hey, this is what you said. This is what the other one said. Do you agree, disagree, contest, deny? Do you want to, give me a different answer? We kind of do that 2 or 3 times. What that does is that really does 90% of the elimination of hallucinations, because anybody's talked to a GPT model or a Gemini. If you kind of ask it with a little more authority and go, are you sure you meant that? This is what I think. You'll actually, root out more of a realistic answer, and it'll go back and correct itself. And so that middleman arbitration is keeping not only the foundation models honest, but at the same time removes the hallucinations from our own internal model as well. So, and the last piece is we keep our context windows incredibly small. Each one of our runs, the entire report might be multiple, 3 or 4 million tokens in total, but each one of our analysis prompts and runs, both internal and external, are maybe 10, 25,000 tokens at the most. So we really try to gate everything in a way. Plus the input and output guardrails that we have around all of our prompts internally and externally are so restrictive that we really root out a lot of the external stuff that comes into LLM integration when it comes to analysis.
Okay. So we're going to be getting into this in a different episode, but I wanted to briefly ask you guys about the kind of case studies that you guys are seeing so far and what kind of results you're seeing from individuals and from practitioners. And is there any 1 or 2 specific stories that have really stood out to you so far?
Steve's got a good one.
Yeah, I've got a few, and it's hard to pinpoint just one. So maybe we should leave some teasers out there for future episodes where we can really deep dive into the amazing response that we've seen. I think for this talk, let's use my story, right? I'm the founder, right? And kind of like the hair club for men, I'm not only the president, I'm also a member, right? You have to be, obviously I don't I have the hair club piece, but that's okay. That's okay. We're okay with that. No, I think my story is really pretty impactful of what you can see as the outcomes of a protocol like this, of this type of reasoning engine that can really give you full system analysis. As I mentioned earlier, I have an autoimmune disease. It's CIDP, all right, chronic inflammatory demyelinating polyneuropathy. I've lived with it for almost 20 years now. Actually, this year will be 20 years that I've had this disease. It starts relatively relapsing, remitting, and then it moves into more progressive, and where the breaks in between the flare-ups are more close together, right? So, when I first started it, I could go a year without any issues, and then I would go 6 months and closer together. Treatment plan for this is varied, right? And even just identifying and figuring out what's going on with it is varied, right? Because it's responsive to all sorts of different, medicines, and then you think you got it, and then you don't have it, all this good fun stuff. Well, the fact of the matter is, about a year ago, I was in a wheelchair, straight up in a wheelchair. And I had progressed beyond a cane. I had used a cane for a while to bilateral support. So I was using a walker, and then to the fact that I just couldn't lift myself up anymore. I had to use a power wheelchair because I don't even have, it works in the extremities. I didn't even have the arm strength to do a manual wheelchair. I needed to actually use a power wheelchair. So after doing all of this with my doctor for years and working through this, and one other thing, I was completely areflexive, no reflexes whatsoever. Hammer on me all day long, nothing was going to happen. Right. So after all of this, it's like you kind of run into a situation where you're like, okay, what's managed quality of life? Right. Because you're like, I'm a father, I'm a husband, I still have responsibilities to my family to try to get, keep them going and keep things on the rails, let's just say.
Yeah.
So going through this, and John introduced me to Nexus because, we were talking about this, and I know he shared the stories of his family, but he and I have also been friends for a long time. He knows my story too, and I know that was part of his inspiration for taking this further than he initially thought. But I was one of the first people to try it. Like, hey, this sounds like it could really help. And I'm one of those weird cases that would be funny if it did help. Let's take the most extreme case we can find.
Right.
That's me.
That's the biggest challenge we could.
Yeah, right. So we did my my analysis and started on my protocol. And and I know it sounds crazy, but by week 7, my body had rebounded to a point where I could get up and move around. I was out of the wheelchair. I was starting to regain the strength in my extremities and being able to support my weight on myself. And I still need a bilateral support. I don't want anybody to think that this is just some sort of miracle that fell out of the sky. It was a process, but I was able to move around again, which is amazing. And then, by about week 13, I was actually able to move back to unilateral support. Which is amazing. And I'm still using unilateral support today. I still walk with a cane, but I walk with a lot more confidence and I respond so much faster. When I have a bad day, I bounce back so much quicker. Whereas before it took me days, sometimes weeks to bounce back from a really bad day. And then on December 22nd, and at that point in time, I've been on the Nexus protocol for 8 months. On December 22nd, I went to my neurologist, and for the first time in years, when he hammered on me for my reflexes, I was actually reflexive again. Right? It's amazing. It's amazing what this can do, the power of this. And a lot of health and wellness sounds just like these ethereal snake oil salesmen, right? But the fact of the matter is I've seen it firsthand. I know. And the people around me know. They saw me go through the pain. They saw me go through the challenges. They saw me go off that cliff to where I wasn't able to live my normal life anymore. And they've also seen me come out of that cliff. And then people will ask me, wow, what happened? Well, Nexus Health is what happened, right? It's really what drove me forward. So I know that was probably a very long-winded story and more than you were looking for, but I think it's an important one as one of the use cases as not just a co-founder of this company, but it really the personal impact it can have. And I have multiple more that I could go through, but we'll save those for another time.
Yeah, I'm excited to hear more about that because that's incredible. It's an incredible story.
Thanks.
Okay, well, we have to wrap up here soon. So the last thing I'd like to ask you both is if someone could take one thing about what problem Nexus Health solves, what should it be?
Go ahead, John.
Don't be trapped in the current healthcare industry that has an incredibly biased look. Don't, be open to looking at how you actually function as an individual. I guess the one key takeaway, like here's my long of the short of it, right? It's maybe a new concept, but having a series of I don't know what to call us, aerospace engineers, or if you look at my background in our engineering, not myself, but also my co-developer's background. If you look at our background, we're equivalent of PhDs, right? We manage data centers that run the global infrastructure of today's financial market and send stuff into space. So you take that same concept and the same type of engineering mindset and analytic mindset and apply that to human health. It's a way different outcome than when a industry trained medical professional looks to prescribe you something. We're looking for a root cause analysis with a direct, accomplishable, measurable result, rather than here's a prescription or here's a recommendation to something that several people will make money off of. It's a very unique way to start looking at health and wellness at an engineering aspect rather than a kind of a clinically trained. And I'm not saying doctors are not, they're that's not the problem, right? It's when you look at something, when you look at a problem through a different lens, and they both have the same prowess, technical prowess, you get different results and different outcomes. So I think the key takeaway would be maybe have a different observation of your health rather than what the industry tells you to do.
I love that, and I'm going to say that, my key takeaway that I would say is for all my functional health, concierge, longevity, just health and wellness in general, people, practitioners out there that have been pounding their head against the wall, trying to become more ingrained, more mainstream in the way that you can drive people's health because you've seen the proof yourself. Don't be afraid of AI. Don't be afraid of the future. Mm-hmm. The time is now. Right? You are at the right point in time in history to reset the healthcare system, to rebuild it the way that it should have been built to begin with. You're driving the success of people's health. You're driving them to live better lives. We're here to help you along that journey.
And remember, AI isn't going to replace doctors, but doctors using AI will definitely be displacing one's not.
Absolutely. Let's drive those efficiencies.
Yep.
Nice. Well, is there anything else you guys would like to add before we end this?
No, just thanks for having us. It's awesome to get to talk about this. If you can't tell, we're obviously very passionate about what we do. So, I'm looking forward to the next time.
Yeah, likewise.
Nice. All right, perfect. Well, thank you both for joining me. Next time, we're going to be talking about breaking down the actual report and kind of looking through, like, under the cover and seeing what it actually looks like. So, yeah, thank you again.
Awesome.
Thank you.